This is a review on the Norco Extension Tube orthotic. It has a beautiful design. It is circumferential in nature. Upgrades include a lining of the internal portion of this neoprene orthotic. The length has a great anthropometric design for length of digits. It has a nice flap on the back that allows for easy fit and application. Extremely strong in design, and it provides a nice circumferential lift to defeat stubborn contractures of the PIP joint. Another shot of this orthotic demonstrates that the thickness of the neoprene is very, very high quality. The comfort and the way the orthotic fits, as described by the patients, is very strong but comfortable. The orthotic beauty also is you can leave it long, staying at the fingertip to give more lift through the PIP joint, or you can cut it shorter and adjust it to allow for the ORL, the oblique retinacular ligament, to be exercised by moving the tip of the DIP joint. This orthotic can also be adjusted for fit, particularly if you're going after hard joint contractures. The orthotic can be adjusted on the side for the arterial flow, both sides of the arterial flow, by cutting a 1/4 inch to a 1/2 inch notch into the material. You also can release the venous output flow on the dorsal aspect of the digit. So once you apply the extension tube, if your finger is becoming red or white, the options are to open up the arterial flow on the sides of the digit, and if the finger becomes bluish in nature, you would cut the dorsum of the orthotic. Here is an orthotic that has been fully adjusted. We have cut the arterial flow on both sides, and we've cut the venous flow on top. We also adjusted the tips. You can actually adjust the tips by cutting the sides on either side and also the top to give a final custom fit. This orthotic was adjusted to allow ORL motion through DIP flexion, as well as releasing the arterial flow and the dorsal flow. This example, just basic, using a pair of scissors to cut the tip of the finger to fit. We also can maintain stability of the integrity of the orthotic by using super glue. I prefer to wrap the finger once I've cut it with a piece of moleskin. Both are very effective. And you can see fully adjusted orthotic with adjustment here, adjustment for the arterial flow, and the venous flow. Again, these are not necessarily have to occur, but when you're chasing a very tough contracture, this is extremely valuable, and that allows you to give you the option to use this orthotic throughout the entire treatment process, period. You also, when you're dealing with small fingers, if you need to adjust to get a deeper fit, you can adjust the areas around the web space of each of the radial and ulnar side of the finger to allow the orthotic to fit more proximal and change. But overall, the orthotic has a tremendously well designed and very durable, which allows you to make these adjustments. The beauty of this orthotic is that you can change the length to allow a variety of different treatment options. You also can leave it long to give you a longer lever arm for a PIP joint problem. The unusual shape of the orthotic where it's circumferential in nature but also has a lift like this gives the orthotic a very unique capacity to defeat a contracture with a low load, long duration application. When dealing with joint contractures as well, you'll oftentimes have chronic swelling that occurs in the PIP joint itself, and the circumferential nature of this orthotic will help defeat the edema, and you can control the lift by adjusting the orthotic as well as help maintain appropriate blood flow to the tip of the finger. This is an example of the orthotic has been fully adjusted to fit by cutting the ends, adjusting blood flow at the very tip, as well as blood flow, arterial inflow and venous outflow. Another example, again, around the tip, cutting the length, venous outflow back to the heart, and arterial inflow on each side. The application of the orthotic on the finger, and it comes with a nice packaging, very simple to read instructions on how to fit for the appropriate length and size of the finger, and I believe this will be a big success.